I'm Dr. Cortney Jessee. I am an occupational therapist in North Carolina. I'm also a certified stroke rehab specialist. I've been an OT for 6 years, and predominantly my career has been in inpatient rehab and outpatient neurospecialty unit. Saebo has radically changed how I practice, treat, and provide access to patient care. I've seen this at both the inpatient and outpatient level to be able to provide patients that first glance of how they're going to take in charge and in control of their neurological condition. I truly believe in the Saebo mission that there is no plateau, so to be able to not only treat but provide assistance in the home environment and empower our caregivers to support their loved one has just been revolutionary in how I'm able to provide the novel, repetitious, and intense neurological rehab potential for our patients, so truly changing lives. Coming off of COVID-19 as a neuro inpatient rehab provider, I made the switch to our outpatient therapy services, and I saw a great need for our patients. There were very limited neuro rehab technology, as well as our patients didn't necessarily have the access to the day-to-day tools necessary to change their own lives. And so I was able to, through the foundation of our hospital providers, to write a grant. And over the course of 2 years in working with Saebo, with Bianca and Katie there, I was able to provide and provision for the necessary tools to reach clients in a way we've never been able to reach before. When writing a grant and when being able to speak to the foundation in order to provide these services, I really feel like Saebo's technology speaks for itself, as well as our patient testimony. And so it was not difficult to justify the need, especially given the amount of research that Saebo continues to provide in the field. And so in writing the grant or trying to maintain different funds to be able to provide patient needs, again, the technology speaks for itself. So to be able to provide the funds, it was a painstaking process. At first we were denied by a couple of other funding services, whether it was because they didn't understand the technology or they didn't understand our practice, but through advocating for what I believe my profession to be in occupational therapy, as well as the change that I know Saebo can provide, we were able to provide patient testimony to our foundation members, which really set the tone for getting this technology here. Throughout my career, shoulder subluxation has been the greatest barrier to patient success when it comes to their musculoskeletal as well as their neurological conditions. And I was seeing this as a great need across both acute, inpatient, and outpatient settings, really the entire continuum of care post-stroke. What I've noticed with the Saebo Stim 1, it is the only device that I've come in contact that not only empowers our patients to manage on their own individually, but also provides the 6 to 8 hours of cortical activation necessary based on the research to be able to elicit that change. We have patients that have come to us completely flaccid with a subluxed shoulder and have seen great success in functional return. Again, it's the only device that I know that can not only provide proximal support but distal support, and it's one that I would recommend to anyone recovering from a neurological injury.